Dear students, welcome to our learning community. We share medical education and MCQ practice to help you succeed in international exams. Each video is designed to build understanding, inspire success, and make learning enjoyable. Together, we grow and create a brighter future. In this session, we'll be learning about the anatomy of joints, an important part of the skeletal system. Joints, also known as articulations, are the points where two or more bones meet. They play a vital role in providing movement, flexibility, and stability to the human body. In this lecture, we will discuss the classification of joints, their structure and function, the types of movements they permit, and some important clinical applications related to joint health and disease. So, let's begin our exploration of the fascinating world of joints. A joint is a point where two or more bones meet, allowing for movement, support, and stability of the skeleton. Joints are essential because they enable us to perform everyday movements like walking, bending, and turning, while also maintaining the structural integrity of our body. Joints are classified in two main ways. Functional classification, based on how much movement the joint allows. Structural classification, based on the type of connective tissue that joins the bones together. Now, let's talk about how joints are classified. Functionally, joints are categorized based on the degree of movement they allow. Synarthrosis, immovable joints, like the sutures of the skull. Amphiarthrosis, slightly movable joints, such as the intervertebral discs or pubic symphysis. Diarthrosis, freely movable joints, including most of our limb joints like the shoulder and hip. Structurally, joints are classified based on the type of connective tissue that binds the bones together. Fibrous joints, held together by dense collagen fibers, allow little or no movement. Cartilaginous joints, where bones are connected by cartilage, permit limited movement. Synovial joints, the most movable type, are held together by ligaments and contain a fluid-filled cavity that allows smooth motion. Understanding both classifications helps us link the structure of a joint to its function in the body. This table summarizes the functional classification of joints, based on how much movement they allow. Synarthrosis joints are immovable, such as the sutures of the skull. Amphiarthrosis joints allow slight movement, like the intervertebral discs and pubic symphysis. Diarthrosis joints are freely movable, and include most of our limb joints, such as the shoulder and hip. Synarthrosis joints are movable joints. The bones in these joints are tightly bound together, allowing no or very minimal movement. Examples include the sutures of the skull, where the bones interlock, and gomphoses, the peg and socket joints that hold our teeth in the maxilla and mandible. Amphiarthrosis joints are slightly movable joints. They allow limited movement, which provides both stability and flexibility. Examples include the intervertebral discs, which connect the vertebrae of the spine, and the pubic symphysis, which joins the two hip bones at the front of the pelvis. Diarthrosis joints are freely movable joints, allowing a wide range of motion. These joints are typically synovial joints, with a fluid-filled cavity that reduces friction and facilitates smooth movement. Examples include the shoulder, hip, elbow, and knee joints, which are essential for activities like walking, lifting, and reaching. Joints can also be classified based on their structure, which depends on the type of connective tissue that joins the bones. Fibrous joints are connected by dense collagen fibers and do not have a synovial cavity. Examples include the sutures of the skull, syndesmoses like the distal tibiofibular joint, and gomphoses, which are the teeth in their sockets. Cartilaginous joints are connected by cartilage and also lack a synovial cavity. Examples are the intervertebral joints, pubic symphysis, and the first rib attaching to the sternum. Synovial joints are the most movable joints, held together by ligaments and containing a synovial cavity. Examples include the shoulder, hip, elbow, and knee joints, which allow a wide range of movement. Fibrous joints are joints where bones are held together by dense collagen fibers, and they do not have a synovial cavity. Movement in these joints is very limited or absent. Examples include sutures of the skull, syndesmoses such as the distal tibiofibular joint, and gomphoses, which are the teeth held in the alveolar sockets of the maxilla and mandible. Cartilaginous joints are joints where bones are connected by cartilage and do not have a synovial cavity. These joints allow slight movement, providing both stability and flexibility. Examples include intervertebral joints, the pubic symphysis, and the connection of the first rib to the sternum. Synovial joints are the most freely movable joints in the body. The bones are held together by ligaments, and a synovial cavity is present, which contains fluid to lubricate the joint and reduce friction. These joints allow a wide range of movement, making them essential for activities like lifting, walking, and rotating. Examples include the shoulder, hip, elbow, and knee joints. A synovial joint is a freely movable joint in which the articulating bones are separated by a synovial cavity containing synovial fluid. Key features include a synovial cavity, which reduces friction and allows smooth movement. Bones held together by ligaments to provide stability. Articular cartilage, about 2 millimeters thick, covers the ends of bones to cushion and protect them. An articular capsule surrounding the joint, made of an outer fibrous capsule and an inner synovial membrane, which secretes synovial fluid. Synovial joints are classified based on the shape of their articulating surfaces and the range of motion they allow. The ball and socket joint is a multi-axial synovial joint, which allows movement in all directions. Structurally, it consists of a spherical head of one bone fitting into a cup-like socket of another bone. This design allows flexion, extension, abduction, adduction, circumduction, and rotation. Examples include the shoulder joint, also called the glenohumeral joint, and the hip joint or acetabulofemoral joint. The hinge joint is a uniaxial synovial joint, meaning it allows movement in one plane only. Its structure consists of a cylindrical projection of one bone fitting into a trough-shaped surface of another bone. This joint permits flexion and extension. Examples include the elbow joint, the knee joint, and the interphalangeal joints of fingers and toes. The pivot joint is a uniaxial synovial joint, permitting rotation around a single longitudinal axis. Structurally, it consists of a rounded or pointed surface of one bone articulating within a ring, formed partly by bone and partly by ligament. Examples include the atlas axis joint between the first two cervical vertebrae, which allows head rotation, and the proximal radioulnar joint, which allows forearm rotation for pronation and supination. The ellipsoidal or condyloid joint is a biaxial synovial joint, which allows movement in two planes but no rotation. Structurally, it consists of an oval-shaped condyle of one bone fitting into an elliptical cavity of another bone. Movements include flexion, extension, abduction, adduction, and circumduction. Examples include the wrist joint. The plane joint is classified as a non-axial synovial joint. Structurally, it consists of flat or slightly curved articular surfaces of bones that slide over each other. The primary movement allowed in this type of joint is gliding or sliding, although the range of motion is very limited. Common examples of plane joints include the intercarpal joints, found between the carpal bones of the wrist, the intertarsal joints, located between the tarsal bones of the foot, as well as the acromioclavicular joint and part of the sternoclavicular joint. The saddle joint is a biaxial synovial joint. Its articulating surfaces resemble a rider sitting on a saddle, with one surface being concave and the other convex. This unique structure allows a variety of movements, including flexion, extension, abduction, adduction, circumduction, and limited rotation. Notable examples of saddle joints include the carpometacarpal joint of the thumb, located between the trapezium and the first metacarpal, as well as the sternoclavicular joint. The condylar joint is a biaxial synovial joint. Its structure consists of an oval condyle of one bone fitting into an elliptical cavity of another bone, similar to an ellipsoidal joint, but it may also allow slight rotation. This joint permits a range of movements, including flexion, extension, abduction, adduction, circumduction, and limited rotation. Examples of condylar joints include the radiocarpal joint of the wrist, the metacarpophalangeal joints of the knuckles, and the atlanto-occipital joint, which connects the occipital condyles of the skull with the atlas. Synovial joints can be classified based on the number of axes they allow and the types of movements they permit. Plane or gliding joints allow simple gliding movements between flat or slightly curved bone surfaces. Uniaxial joints move around a single axis. For example, hinge joints permit flexion and extension, while pivot joints allow rotation only. Biaxial joints move around two axes. Condylar joints enable flexion, extension, and limited rotation, whereas ellipsoid joints allow flexion, extension, abduction, adduction, and circumduction. Multiaxial joints move around multiple axes. Saddle joints permit flexion, extension, abduction, adduction, and rotation, while ball and socket joints, also called spheroidal joints, allow flexion, extension, abduction, adduction, circumduction, and rotation, providing the greatest range of motion among synovial joints. Applied aspects of joints. Arthritis refers to the inflammation of one or more joints, resulting in pain, swelling, and stiffness. It commonly affects the knee, hip, fingers, and spine. Osteoarthritis, also known as degenerative joint disease, involves a progressive wear and tear of articular cartilage, leading to pain and restricted movement, particularly in the knee, hip, and vertebral joints. Rheumatoid arthritis is an autoimmune disorder that causes chronic inflammation of synovial membranes and can lead to joint deformity. It typically affects the small joints of the hands, wrists, and feet. Dislocation or luxation is a displacement of bones from their normal alignment at a joint, most commonly seen in the shoulder, but also in the jaw and fingers. A sprain is a tearing or stretching of ligaments without dislocation, frequently occurring in the ankle, knee, and wrist. A strain involves the overstretching or tearing of a muscle or tendon near a joint, commonly affecting the back and hamstrings. Bursitis is the inflammation of bursae, usually caused by repetitive movement or trauma, and is often seen in the shoulder, elbow, and knee. Gout results from the deposition of uric acid crystals in synovial joints, causing severe pain and inflammation, most often in the big toe's metatarsophalangeal joint. Finally, arthroplasty refers to the surgical replacement of a diseased joint with an artificial prosthesis, commonly performed in hip and knee replacement surgeries. That brings us to the end of today's lecture on the anatomy of joints. Thank you so much for watching. If you found this lecture helpful, please like the video, subscribe to the channel, and hit the notification bell so you won't miss any future lessons. Keep learning, stay curious, and I'll see you in the next session.